A 20-year-old infant is brought to the emergency department by her parents. They are concerned that she has been lethargic recently and have also noticed easy bruising. Her mother reports that she has been eating less for the past few days. Today she was difficult to arouse. She normally nurses 4 to 5 times a day but ate less yesterday and this morning. The girl was born in 39 weeks gestation via spontaneous vaginal delivery at home with minimal prenatal or postnatal care. This is her first visit to a physician of any type. The family is carefully questioned and child abuse is ruled out. The patient's pulse is 97, respirations are 35, temperature is 35.8, and the blood pressure is 71 by 46. Physical exam shows diffuse petechiae and bruising. Which of the following is the most likely cause? Group B streptococcus infection, hepatitis B, thyroid stimulating hormone deficiency, vitamin D deficiency, vitamin K deficiency. Okay. Here there is deficiency of vitamin K. So, see, in such cases, what is the classic hint that they give in the question? It is that there was vaginal delivery at home. Okay. Whenever this is given, you should think of, not always vitamin K deficiency, but the other way around. If the answer is vitamin K deficiency, it is usually given as there is a delivery at home, because when the babies are delivered in the hospital, they are given vitamin K shot at birth, because they usually develop the vitamin. They are deficient in vitamin K, right? So here, what are the other clues or keywords in the question? There is easy bruising, one of the things. On physical exam, there is petechiae and bruising, right? Because of vitamin K deficiency, there is no activation of all the clotting factors, which leads to bleeding in the form of petechiae. Now, just every time in the exam, even if you know that this is the correct answer, it's very important to rule out all the other options, which will do that for every question. What about group B strep infection? In this case, there is usually fever, and there is seen when a lot of times when there is premature delivery, low birth weight babies, and there is fever, and the patient is not very comfortable, and there's septic shock and everything. And most importantly, there is no petechiae or bruising seen in GBS infection, so that is ruled out. Hep B infection, again, it will not present with petechiae and bruising. There will be jaundice and icterus and all of those seen, and there will be a history of hepatitis B in the mother. Thyroid hormone deficiency, again, there is nothing to suggest thyroid here. There is no cold intolerance. In newborn, if there is hypothyroidism, then there will be a classic cases seen where the trunk is protruding out, or if there is an umbilical hernia, there is weight gain, cold intolerance, improper feeding, all of those. Vitamin E deficiency, this is your rickets, and it will not be, again, it will not manifest in this age group in a 20-day-old infant, and it will present, usually it will be evident when the child starts walking, when there is this bending of knees and the legs, and another manifestation like tachytic rosary or bone pain, all of that. This is not vitamin deficiency. This 20-day-old infant which was delivered at home and now has petechiae and bruising is classically vitamin K deficiency.
Thanks for watching. Please give a thumbs up and subscribe for more.